Hello, this is Adriana Mares, reporting from Fits on the Go at the American College of Cardiology 2023 scientific sessions together with the World Congress of Cardiology in New Orleans. And today I have the distinct pleasure of interviewing Dr. Garima Sharma, who is the director of the Cardio-Obstetrics Program, also the Associate Professor in Medicine and Cardiology at Johns Hopkins University, and the Associate Vice Chair of Women's Careers there. Thank you so much for taking the time out of your busy schedule to join us today, Dr. Sharma.
My pleasure. Thank you for having me.
Dr. Sharma has mentored countless medical students, residents, and fellows, and today's discussion focuses on the top 3 advice that she would share with second-year internal medicine residents that are looking into applying for cardiology. Dr. Sharma, would you please give us what those 3 top advices that you would give a second-year internal medicine resident?
Thank you for that question. I think the question is really important because internal medicine, you kind of are on the cusp of, a fantastic career. And you have the option of really looking at cardiology programs in your institution. There are some times you are at an institution that does not have a fellowship. So when you join on, knowing very early on that you want to do cardiology, you really want to seek out mentors who do that. So mentorship and sponsorship is essential for a fellowship. Cardiology is a very competitive fellowship. So I think my top 1 or 2 sort of advice would be really seek out a mentor and a sponsor, somebody who you think you want to become or like someone you want to become, and work with them. Don't have to publish a lot, but have to show an inclination towards science because it's a competitive field. The second advice is talk to the current fellows, especially the first and the second year fellows, and understand what their journey was because they're closest to you and they can give you a lot of guidance in the kind of programs that may be friendlier towards your type of designation, like what you want to become. And the third thing, which I tell everybody, not just residents, but everyone, is you should know what your phenotype is. Mm-hmm. That's essential. You have to be very authentic to who you want to be and where you want to go. So if you're a clinician researcher or a physician scientist or clinician scientist, that's your phenotype. You've got to seek out mentors who look and do things like you, who want to be like you. If you're a medical educator, then you got to stay true to what your strengths are, because in your phenotype are your strengths. And those strengths are more positive than all your negatives. So if you work really hard on your positives, you really separate yourself out from the rest of the crowd. And people will recognize who you are based on the work you've done. So build a track record of doing work in that area, because that is what keeps you going and will separate you from the others.
It's been a great discussion. Thank you, Dr. Sharma, for giving us your top 3 advice for second-year internal medicine residents that are thinking of going into cardiology. It's been a great discussion again, and for more videos like these, please visit our YouTube channel at www.youtube/fitsonthego.